Welcome to Sato Career 2.0 online nursing channel. In today's live session, we are going to discuss 50 important questions for upcoming nursing officer exams 2020. In this video, all these important questions are previously asked in any of the exams which you are preparing. So don't miss any questions. Watch all the questions till the end of this video. Before seeing the first question in this video, please subscribe to our channel, Sato Career 2.0 Online Nursing channel. Also click the bell icon to get the latest notification about new videos. Let's see the first question of the day. What is the total score in mini mental status examination? A 25, B 30, C 32, D 35. The right answer, option B. The overall score in mini mental status examination is 30, and if your score is above 24, we consider the patient is having normal cognition. If a person's score is below 9, he is having very poor cognition. Question number 33. What is the symbol in the images associated with? Option A, National Human Rights Commission. Option B, Sarva Shiksha Abhiyan. Option C, International Yoga Day. Option D, National Literacy Mission. The right answer, this image is associated with National Literacy Mission. Government of India started National Literacy Mission on 5th May 1988 with an aim to increase the literacy in India and eradicate illiteracy. Question number 34. Identify the following sign displayed below. Option A, meniscus sign. B, Bovet sign. C, Mercedes sign. D, seagull sign. In this image, you are seeing the sign called seagull sign. Option D is right. Now let us explain something about seagull sign. Seagull is a popular name for a seabird with a heavy body and two long wings. The seagull sign has been used in cardiology for evaluation of the mitral valve and in orthopedics for erosive osteoarthritis. On a plain X-ray or abdomen, on a plain X-ray of abdomen, a tri-radiate collection of a darkness shadow of nitrogen gas within gallstone which creates a seagull sign. So mostly when you do observation in ultrasound in the abdomen when there is gallstone, then you can find this seagull sign. It is also associated with cardiology and orthopedics. Question number 35. WHO defines WHO defines blindness as visual acuity of less than option A 3 by 60, option B 6 by 6, option C 6 by 18, option D 1 by 16. So the blindness according to WHO when the visual acuity is option A 3 by 60. You know that 6 by 6 or 6 by 16, 6 by 6 or 6 by 18 is considered to be a normal vision. When there is less than 6 by 18 or 6 by 60, it is visual impairment. When the score is less than 6 by 60 or 3 by 60, it is considered to be a severe visual impairment. In case of blindness, it will be less than 3 by 60 or less than 1 by 60. That is considered to be blindness. Now let's see the question number 36. Schizophrenia comes under which form of psychological disorders? Option A, dysthymic disorder. B, depressive disorder. C, cyclothymic disorder. Option D, psychotic disorders. We know very well schizophrenia comes under psychotic disorder. It is a major psychotic disorder. where patient does not have any insight. Question number 37, let's see. Licensing laws regulate the practice of nursing to option A, protect the public from injury, option B, ensure that every nursing personnel has good moral character, option C, support nurse employment by limiting the competition, option D, guarantee the best possible nursing care. So licensing law can regulate nursing practice for what purpose? The right answer is it guarantees the best possible nursing care from the nursing personnel. Question number 38. An exaggerated, inappropriate feeling of pleasure is known as A. Euphoria, B. Anhedonia, C. Dysphoria, option D. Perseveration. Exaggerated, inappropriate feeling of pleasure is called euphoria, which is associated with mania. Question number 39. The antenatal diagnosis of all of the following conditions is feasible except in which of the following? Option A, Down syndrome, B, Huntington's chorea, C, severe combined immunodeficiency syndrome, option D, anencephaly. So here, during antenatal diagnosis, we cannot identify a child who is having severe combined immunodeficiency syndrome. So this is least feasible. Right answer is option C. Question number 40. The study of physical and psychological changes which are incident to old ages. Option A, clinical gerontology, B, clinical geriatrics, C, geriatrics, D, gerontology. So the right answer, we have confusion between geriatrics and gerontology. Leave the confusion. Choose option D, gerontology. What is geriatrics? Geriatrics is a branch of medicine or social science dealing with the health and care of elderly people. Question number 41. The nurse assesses a 6 months old child during well baby clinic. Nurse makes all the following observations. Which of the following assessments made by the nurse is an area of concern indicating a need for further evaluation? Option A, absence of mororeflex. Option B, closed posterior fontanelle. Option C, moderate head lag when pulled to sitting position. Option D, 3 pound weight gain in 2 months. So in 6-month-old child, which of the following is considered to be concern for nurse to carry further evaluation? The right answer is option C, moderate head lag when pulled to sitting position is considered to be a concern for proceeding further diagnostic future. Usually within 3 to 4 months, the head lag will be disappear. If still it presents in 6 months, then we can suspect for earlier signs of autism. So choose option C as the right here. Question number 42. Senseless repetition of same words or phrases over and over again is termed as option A, perseveration, C, echolalia, D, perbigeration, option D, neologism. The right answer is verbigeration is called senseless repetition of same words or phrases over and over again. Question number 43. Database program in a computer is an example of option A, operating system, B, hardware, C, application software, option D, none of this. So database program in a computer is an example of Application software is the right answer here. Question number 44. Which of the following antibody gives a prime immune reaction? Option A, IgM, B, IgG, C, IgA, D, IgE. The red line immune reaction, the primary antibody which is functioning as the prime immune reaction is option A, IgM. Sometimes IgG also present, but it is very less in the quantity. Question number 45. Identify the contraceptive device seen in the image. Option A, Mirena. Option B, vaginal ring. C, progestat. Option D, Lippes loop. The right answer, the right answer is Lippes loop. Lippes loop is a type of intrauterine contraceptive device made of inert plastic. It is a double S shape which can be inserted for a long periods. Question number 46. An example for positive feedback mechanism in our body is option A, temperature regulation, B, oxytocin in childbirth, C, baroreceptor mechanism, D, regulation of thyroid hormone. The positive feedback mechanism, the best example here is oxytocin in childbirth is the example of positive feedback mechanism in our body. Question number 47. Identify the supportive organ which you've seen in the box of the image. Option A, tubo-ovarian ligament, B, uterosacral ligament, C, pelvic diaphragm, D, round ligament. The right answer, it is a tubo-ovarian ligament. Option A is correct. Question number 48. A patient is wearing soft wrist safety device. Which of the following nursing assessment is considered abnormal? Option A, palpable radical pulse. B, bluish fingernails, cool and pale fingers. C, palpable ulnar pulse. Option D, capillary refill within 3 seconds. So the following assessment which is considered to be abnormal is bluish fingernail and cool and pale fingers is considered to be abnormal. That is the indicative sign of cyanosis. Question number 49. Which of the following is an early sign of decubitus ulcer? Option A, edema, B, cyanosis, C, skin discoloration, option D, coolness. The early sign of decubitus ulcer or pressure sore is option C, changes in skin color, skin discoloration. Question number 50. The process by which a bacterial virulence power is reduced is known as option A, sterilization, B, attenuation, C, disinfection, option D, incineration. The right answer, when the bacterial virulence is reduced, that is called attenuation. Question number 51. All of the following nursing interventions are correct when using the Z-track method of injection except option A, aspirate for blood before injection, option B, rub the site vigorously after the injection, option C, prepare the injection site with alcohol, option D, use a needle that's at least 1 inch long. So the right answer for this question, option B, don't, rub the site vigorously after the injection. Usually, once you get a Z-track method of IM injection, we are not used to rub the site in a vigorous manner. Question number 52. Fluid overload in a patient may cause A, pulmonary edema, B. Angioedema, C. Peripheral edema, D. Cerebral edema. Fluid overload, hypervolemia will cause heart failure, congestive heart failure that leads to pulmonary edema. Also, there is chance for peripheral edema, but it is later. Question number 53. A method of making the victim to breathe passively is known as option A. Artificial respiration, B. Deep breathing, C. Kussmaul respiration, option D. Spontaneous respiration. The right answer, artificial respiration, is also called passive respiration. When the patient is breathing with the support of some other device, that is called artificial respiration. Question number 54. The percentage and flow of oxygen in a green color Venturi mask is option A 60% and 15 liter per minute. Option B 35% and 8 liter per minute. Option C 31% and 6 liter per minute. Option D 28% and 4 liter per minute. The right answer is, so in a green color Venturi mask, you want to give 60% flow of oxygen and it is up to 15 liter per minute. So this is the flow. We have the various color of Venturi mask and what is the amount in percentage and the flow. You can notice here for blue 24%, 2 liter per minute. In orange that is 31%. In yellow it is 35. Highest in green 60% for 15 liter per minute. Comes to the next question. 55. How a nurse will collect urine sample for culture from urinary collecting system. Option A, with needle aspiration. Option B, empty the urine from bag. Option C, collect from catheter. Option D, disconnect bag and collect. So when the patient is in urinary catheter, we used to collect urine sample from aspiration method. So by needle aspiration method, we used to collect sample for urine analysis while the patient is on urinary catheter. Question number 56. Blood drawn for complete blood count is collected in option A chloride vial, B EDTA vial, C plain vial, option D citrate vial. For complete blood count, the blood is collected in which vial? Option B EDTA vial, ethylene diamine tetraacetic acid, ethylene diamine tetraacetic acid vial. Question number 57. Strength of Savlon for cleaning of wounds. Option A 1:10, B 1:100, C 1:1000, D 1:10,000. The right answer is 1:10. The Savlon strength for cleaning the wound is 1:10. Question number 58. Which type of solution causes water to shift from cells to plasma? Option A hypotonic, B hypertonic, C isotonic, D alkaline. The type of fluid which helps the fluid shift from cells to plasma is option B hypertonic. Hypertonic solution is right answer. Question number 59. What is the usual site of intramuscular injection a nurse will choose in an adult for Z-track technique? Option A deltoid, B ventrogluteal, C rectus femoris, D vastus lateralis. For adult, the nurse select the ventrogluteal site. In case of children, vastus lateralis will be selected. Question number 60. In Benedict's test, which is the end color indicates absence of sugar in urine? Option A, yellow, B, green, C, red, D, blue. The right answer is the color which indicates absence of sugar in urine during Benedict test is blue color. Question number 61. Before saying that, this is the best coaching center for taking nursing officer exam training. It gives more successful nursing officer every year. Join Meteors in New Delhi near Chhatrapur railway station metro. Also, new center will be started in Pondicherry in Tamil Nadu in this month. Question number 61. Why cow's milk diluted 4:1 ratio for first 6 to 8 weeks of birth? Option A, high content of sugar. Option B, high content of fat. Option C, high content of protein and sodium. Option D, all of the above. So cow's milk diluted in the ratio 4:1 for the first 6 to 8 weeks of birth. The reason is the cow milk contains high content of protein and sodium, which is not good for the baby in the initial stage. So it is diluted in the ratio 4:1 with question number 62. A 4.5-year-old child brought to emergency department with a fractured tibia. The nurse knows that in children of this age, the most frequent encountered type of fracture is option A, transverse fracture, B, comminuted fracture, C, green stick fracture, and D, compound fracture. So in 4.5-year-old child, the common type of fracture encountered is green stick fracture. Question number 63. The recommended site for X-ray for bone age determination of 11 to 12-year-old child is option A, elbow and hip, option B, foot and ankle, option C, hands and wrist, option D, shoulders. So at 11 to 12 years of age, the bone age determination is done with the help of X-ray taken in place of hands and wrist. Option C is right. Question number 64. The cartilage that completely encircles the larynx with the marrow part anteriorly and the broad part posteriorly is called option A, cricoid cartilage, B, thyroid cartilage, C, actinoid cartilage, D, epiglottis. The right answer. The cartilage which completely encircles the larynx in the narrower part anteriorly and the broad part posteriorly is called cricoid cartilage. Question number 65. The primary reason for using prednisone in the treatment of acute leukemia in children is that it is able to option A, decrease inflammation, B, increases appetite and sense of well-being, option C, reduces irradiation edema, option D, it suppresses mitosis in lymphocytes. So the main action of prednisone in treatment of acute leukemia is it reduces the mitosis and controls the multiplication of WBC cells. Option D is right here. Question number 66. Middle lobe of the prostate is situated between option A, rectum and seminal vesicle, B, prostatic urethra and ejaculatory duct, option C, pubis and ejaculatory duct, option D, rectum and prostatic urethra. The right answer, option B, prostatic urethra and ejaculatory duct. Question number 67. The enzyme released by the sperm which allows penetration of the ovum is called A, amylase, B, lipase, C. Trypsin, D. Hyaluronidase. The right answer is option D. Hyaluronidase allows the penetration of sperm into the ovum. Question number 68. Inability of the liver to metabolize and remove bilirubin from the biliary system is option A. Hemolytic jaundice, B. Hepatocellular jaundice, C. Obstructive jaundice, D. Hereditary hyperbilirubinemia. The right answer, hepatocellular jaundice prevents the bilirubin. It also prevents the metabolism of bilirubin, and it also blocks the removal of bilirubin from the biliary system. Question number 69. The repair and reconstruction of the joint is called A. Arthrodesis, B. Arthroplasty, C. Amputation, D. Arthrotomy. So the repair and reconstruction of the joint is called arthroplasty. Question number 70. A patient is admitted with a suspected bladder cancer. A nurse assesses the patient for which of the following earliest manifestation of the disease? Option A, hematuria and no pain. B, proteinuria and dysuria. Option C, painful urination and hematuria. Option D, pyuria and palpable abdominal mass. So here, when you suspect for a bladder cancer, the earliest manifestation will be a painless hematuria. Option A is right. So if you are interested in cooking, you can see Yummy Foods India, our YouTube channel. I request all our subscribers, all my friends, my dear brothers and sisters to search for Yummy Foods India in YouTube, and please subscribe, and the same support what you are giving for SAT2 Career 2.0 online nursing channel, please give for our food channel also. Yummy Foods India, we cook various dishes from various parts of India in a simple way, in a yummy and tasty way. Please subscribe to our channel Yummy Foods India. Thank you. Question number 71. Identify the testicular structure in arrow mark shown in the photograph. Option A, rete testis. Option B, vas deferens. Option C, epididymis. Option D, seminiferous tubule. The right answer, it is seminiferous tubules. Question number 72. A significant predictor of fetal well-being is in fetal heart is option A 120 to 160 beats per minute, B 180 to 200 beats per minute, option C 100 to 120 beats per minute, option D 160 to 200 beats per minute. In fetal heart rate is between 120 to 160 indicates well-being of fetus. Question number 73. The most rapid absorption of insulin occurs in A. Abdomen, B. Arms, C. Thighs, D. Buttocks. The right answer is abdomen. Option A is right. Question number 74. Which of the following gas listed below causes global warming? A. Nitrous oxide, B. Sulfur dioxide, C. Carbon dioxide, D. Carbon monoxide. The right answer is option C. Carbon dioxide. Question number 75. Which of the following procedure always requires surgical asepsis? Option A, vaginal irrigation. Option B, urinary catheterization. C, nasogastric tube insertion. Option D, colostomy irrigation. The following procedure which indicates surgical asepsis is option B, urinary catheterization. Question number 76. The size of the intravenous cannula used for neonate. Option A 18, B 22, C 20, D 24. The right answer is 24. Question number 77. Out of the following, which medicines are used for intestinal evacuation? Option A, catharatics. B, carminatives. C, astringents. D, antimycotics. The right answer, option A, catharatics. Question number 78. The waves used in telecommunication is A, radio waves. B, infrared rays. C, cosmic rays. And D, ultraviolet rays. In telecommunication, we are using commonly radio waves. Option A, radio waves is right. Question number 79. Best method to prevent food drop in client on bed rest is to use option A, splints. B, blocks. C, sandbags. D, cradles. Right answer, option C, sandbags is right. Question number 80. Prior to feeding an infant by gastrostomy tube, the nurse should option A, provide baby with a pacifier. B, place the baby in a semi-fowler's position. Option C, aspirate the tube. Option D, slowly instill 5 ml of water. So priorly, when you infant the baby with a gastrostomy tube, place the baby in a semi-fowler's position. Option B is right answer here. So these 50 questions which we have discussed today are considered to be a most frequently asked question in any nursing officer exam, and this is the subscriber challenge question. In every video at the end we are having one question, that is subscriber challenge question, exclusive for the subscriber to answer in the comment box of the video. The question is, what are the classical signs and symptoms of diabetes mellitus? Option A, polycholia, polyemia, polyplegia. Option B, diarrhea, anorexia, weight gain. Option C, polyuria, polydipsia, polyphagia. Option D, constipation, weight loss, thirst. Please write the right answer in the comment box of this video, and the in there will be a reward for all the subscribers who will be answering all the answers correctly. You will get the reward later. We will announce about the reward. So these are the 50 questions which we have discussed yesterday. 30 questions we have seen. If you want to see the 30 question, you can like this video and watch. Please subscribe to our YouTube channel, Satu Career 2.0 Online Nursing channel. Also, please subscribe to our cooking channel, Yummy Foods India. I am giving the link of Yummy Foods India in the description box. And meet you again with another good video. Till then, take care. Bye bye. Take care.